Oh, that's a good point. So what I think I hear you saying is the population of a state that doesn't have a strong board to protect the
they're going to be the victims.
They're vulnerable, right? Because people might do this practice. Actually, that's a strong point, Nick. Here's my counter argument, though.
Okay.
You're not describing gay conversion therapy as the enemy in that. You're describing medical malpractice. You're describing somebody attempting to do psychotherapy who is not licensed for it, and that was the very first crime. The fact that they also tried to do gay conversion therapy, and that's harmful to the population, they're already unlicensed.
Well, maybe not. I mean, what if they have a license?
I guess so, but then it comes down to if the state assembly and senate has the time and the awareness and the interest in mental health to pass a restrictive law, I would much rather see them bolster that board.
I would too.
Let the colleagues police the field.
Yeah, I would agree with that as well. But if they're not, then what?
Right. I get it. I mean, like the UK passes this thing and says, hey, we're not going to do this anymore. Again, my only gripe about it is I don't like to see government and the political winds deciding what we're doing in a session.
Sure.
Because it also introduces limits into what should be an unlimited experience. You're supposed to be allowed to tell me anything. But if now there's boundaries and I know that I could be breaking the law by even listening to you talk about how you have struggles with your sexuality and how you feel internally conflicted, That's problematic for me, man. I don't want to be told how to do therapy.
Yeah, no, I get that. But is that gay conversion therapy? I mean, if I have somebody who's coming in and they are uncomfortable with their sexuality and they just want to talk about it and they want to explore that, we can do that, and that doesn't necessarily, in my mind, doesn't constitute gay conversion therapy.
And that's the question, though, is because you're a therapist and you're thinking it through carefully and comparing it to ethics and comparing it to standards of best practices that you've seen in the field. An assembly member's not going to do that. A judge is not going to do that. The beat cop is not going to do that. They're going to look at the law and it's going to say, no attempt shall be made to alter the sexual orientation of a patient, ever. Period.
Well, that's where you just get into careful note writing.
Yeah. I've committed all sorts of crimes. I just write them up.
Well, no, but I mean, if I'm documenting this as I am exploring this with the client,
right?
I'm not suggesting, I'm not pushing them one direction or the other. I'm just helping them sort out their thoughts and feelings.
But what you just said is the key phrase that I want you to zoom in on. I'm going to win you over to my side.
Okay.
Watch.
All right.
Here's the key phrase, because you said, well, I'm not going to influence their decision. I'm just exploring it with them. The reason you can make that statement confidently, and I know that you would never influence them, I know that you would just listen to them, is because you're a good therapist. Because you already have ethics and lots of training and best practices that have taught you never to influence the client, right?
Right.
We already don't do that. So you're not describing gay conversion therapy as something that was always an orthodox practice that we need to take away from the table of good ideas. It was always in the trash bin of unethical ideas. It's up there with changing somebody's religion. If they come in and go, hi, I'm a Buddhist, and you're like, all right, we're going to fix that. You should lose your license. Like right there, you should lose your license because you're imposing culture and influence onto a person to try to take away something from them or change a perspective of them that you don't personally align with. Inherently, that was in the trash bin of unethical ideas. So is gay conversion therapy.
So who has been doing gay conversion therapy? Are they actually licensed therapists, or does this tend to be more clergy?
It has tended to be more clergy.
Oh, okay.
Yeah, but that comes back to your point about Arizona, right?
Right.
Because licensed therapists have a board to answer to. They're usually highly trained. If they're doing this, it's very, very rare. It's very, very rare. Usually it turns out to be a pastor or like some kind of church that has like a ministry where there's like little counseling guys and they're not necessarily licensed. So usually these kinds of bans are a shot across the bow to all those organizations to say, hey, you will not do this. Gotcha. That's not allowed. And to that extent, it's fine. But it doesn't usually caveat that, hey, and let therapists do their job. Like, we're not here to dictate how therapy is going to happen.
So if there was... Okay, so let me throw this at you, because this may sway the argument a little bit.
Okay.
If there was clergy out there doing gay conversion therapy, and there's no law against that, and they are not answering to a board, then it just continues.
Yeah.
There's nothing stopping them from doing it. It's the same as life coaching. You don't need You don't need a license to be a life coach, at least here in Nevada. You can just open up shop and call yourself a life coach and do it. So what's to stop me from being a life coach and imposing my religious beliefs, or lack thereof, on somebody and doing gay conversion therapy?
All right, good question. Here's my counterpoint. Okay. I like this debate that we're having. This is an academic debate. If we start policing all possibly harmful things that institutions, religious or not, do to members of that institution, and align that with what is helpful, what is hurtful, and start passing laws to stop them from doing everything, where does it end, right? True. So if you voluntarily align with a faith, you say, I vote Episcopalian, that's the team I like, and then you start having beliefs or feelings that are inconsistent with the team you like, and so then you go to the coach of that team and say, hey, I have thoughts and feelings that are no longer consistent with our team principles, and that coach says, let me help train that out of you, and we say, we're going to stop you from doing that. We're passing laws about gay, therapy, gay conversion. Why can't it also be Republican? You can't vote Republican, or you can't vote Democrat. Hey, I'm having strong thoughts that maybe I'm feeling liberal, and I feel like we should have a generous tax policy that redistributes wealth to the poor. Whoa. We're Southern Baptists. We don't do that. Well, I mean, that's kind of how I feel. Well, let's have counsel about that, right? You voluntarily align with our team. That's inconsistent with the stated rules of our team. We publish this on the internet. You know that. I know that. Let's discuss and get congruence. Well, then we go, whoa. We're not going to have this kind of political conversion counseling, okay? We're not going to allow it. Like, you can't. So, like, my question is, where does it end, right? And so I can see this as a unique thing, because we could say that people that are in that vulnerable place are a special population. And I think that the government has a good history of passing special rules to protect special populations. So in that light, it's fine. But I struggle with it, Nick, because I don't do that, but I don't do it because it's in the trash can of ethics. Like, you don't do it anyway. Just like you don't change their religion or try to change their political persuasion. Like, why would you do that? Like, you're there to work on the problems they define, and only through the lens of what is ethical. But I don't know, but the UK did it, so good job, Britons, and I ultimately think it's well-spirited anyway. I think it's a good idea.
Well, I would agree. I think we're on the same page.
Yeah.
It's just a matter of how much do we want law coming into play.
Yeah, it's hard to have this conversation as you're sitting here sipping a pina colada, though. It is weird.
Get over it.
Listen, I accept you.
I'm not changing my ways.
I'm not. All of our UK listeners are like, should I report this? I feel like Jim was just trying to convert Nick.
So actually, this would be a good thing for our listeners. Write in, let us know your thoughts.
Yeah,
I'm kind of interested to get everybody's take on that.
Yeah, we usually take questions from listeners, but I'd love to take comments. Just people writing in and going, so last week's episode you said this, and I think Jim's an idiot. That'd be fine.
I'm writing that email right now.
Yeah, Nick's typing as we go.
All right, we're going to go ahead and take a quick break. When we come back, we will discuss recreational drug use. You're listening to Pod Therapy.
We're back. You're listening to Pod Therapy, and it's time to read our listener mail. So, Nick, this first question is, should I tell my therapist about my recreational drug use?
Okay.
Before I even read this, I'm thinking, yeah, I'd like to know.
Yeah.
It's usually a good thing to know. All right, here's what the listener writes. I have not seen a therapist in about 3 years, but I will be seeing a new therapist soon for depression, and probably bipolar 2. I also have anxiety issues. I am not taking any prescription medications right now. I know that the doctors and therapists will ask about drug use, but I'm uncomfortable discussing that with them. I've experimented with recreational drugs on occasion, but I don't use drugs regularly. I smoke marijuana several times per year. I've had cocaine 3 or 4 times. I've smoked DMT twice, and I've used normal doses of LSD several times. I've found micro doses of LSD to be helpful in managing my symptoms without any psychedelic effects and without the side effects I got when I was on antidepressants. My symptoms predate my drug use, and I don't use any recreational drugs when my symptoms are more severe. I don't believe there is anything morally wrong with using recreational drugs, and I don't feel like it has caused any negative effects in my life. I'm comfortable with the risks I'm taking, and I believe that I use drugs responsibly. I don't intend to mix any recreational drugs with prescribed medications. I worry that if I tell my therapist and psychiatrist about it, that they will be unwilling to prescribe medications to me that they would otherwise recommend. I feel like it's not relevant to my treatment, but I also don't like being dishonest about it. What risks am I taking by disclosing my drug use to my doctors? Will that become part of my medical records? If I tell my therapist but not my psychiatrist, will that information be shared? I will be using the health services of my Native American tribe. Are they bound to the same confidentiality protections as non-tribal therapists? If I knew that there would be no downside, I wouldn't mind discussing it, but I feel like once I bring it up, that bell can't be unrung, and I worry that I will regret it later. Thank you for any advice and clarity that you can bring to the situation.
Okay, that was really good.
Yeah.
There's a lot of really good, interesting questions in this. So... First off, I guess I'm going to try to answer as many of these questions as I possibly can. You know, with the question of should I tell my therapist, psychiatrist, or both, one or the other?
And you know, another thing too, Nick, I have to define some terms in here.
Yes.
I mean, the average listener doesn't know what microdoses are, might not even know what some of these drugs are.
Right.
What is bipolar 2? There's a lot there.
Right. So I guess the important ones to note here, microdosing essentially is taking a small enough dose of the substance where you're not getting kind of the full effect, I guess you would say. Right. Or if we're talking about like a hallucinogen, you're not getting the intense hallucinations that you would normally get. You're getting just kind of a little bit of a smaller sensation. DMT is dimethyltryptamine.
Molly, right?
No, it's not. That's MDMA. DMT is an active ingredient in like ayahuasca.
Oh, okay.
So that's one of the main active ingredients. It's basically what you need to know is it's a hallucinogen.
And that's the thing, is like the writer talks about taking hallucinogenics, and they talk about microdosing. Microdosing is sort of this new fad where I'm seeing it all the time. People are like, I'm not a drug addict. I don't have the problems that other people have.
Right.
But I microdose on LSD. And I'm like, what? You microdose on LSD? And they're like, yeah, it helps my creativity. It, helps me get through the day. And it kind of reminds me of those old movies where the guy would have like a little canister of cocaine and he'd take like a pinch of it and snort it in his nose and like another pinch in the other nostril, and then they like do that and
Right.
and they take it all in. And so it's like this fashionable new way to like use drugs in like a responsible way. Like I'm just taking little puffs throughout the day, and I'm not like hallucinating dragons, but I'm seeing the world from a new perspective.
Well, I mean, and I'm not really, at this point, I'm not going to come out and take a stand one way or the other on that, because I'm always the type where I want to know where the research leads, right? And there has been some interesting research looking at its effects and how it's used to treat PTSD, things like that. So I'm open-minded. I don't really have an opinion one way or the other yet. I mean, as far as who to tell and how much to tell, as far as your therapist and psychiatrist, I'd say tell them both, to be honest. It's one of the things that Jim always likes to say, somebody you never lie to is your tailor.
Yeah.
Right?
Yeah.
Sucking in your gut while you're getting fitted for your pants, you're only fooling yourself.
Don't lie to your tailor.
It's only going to hurt you in the long run. Your therapist is kind of the same way. If you're going into therapy and you're not being 100% honest, what's the point?
Right.
You're not really going to get the full effect. Most therapists that I know of are going to be very open-minded about this. They're not going to, it's not something that they're going to look down on you for. They're going to appreciate the honesty, number one. And it's something that they can work with you on. As far as the psychiatrist, you mentioned in there that they might not prescribe or would be unwilling to prescribe medications that they otherwise would have. Probably, but that's a good thing. Like you want your psychiatrist to know this information, because if they're prescribing medication, it could be ineffective if you're using other substances, or could be harmful if you're using other substances. Even if it's not harmful, if it's just ineffective, well then again, you're kind of wasting your time. You're wasting your copay on this medication that isn't going to provide you the results that you're looking for, and your psychiatrist and your therapist are going to be wondering, why are we not seeing any results? We're doing this treatment, this should be working. It's always best just to be upfront and honest with them as you are explaining all this.
I agree. And, you're only fooling yourself. And I can see what the person's doing. And I've seen this before, Nick, where they don't trust the process, right? And they're like, well, the drugs are not the issue. I don't want that to become a red herring. I want you to focus on my symptoms, right? But you have bipolar 2, which inherently is going to require probably some kind of mood stabilizer or antipsychotic.
Right.
So for that psychiatrist to approach this authentically, honestly, he needs data, right? We are medical professionals. Give us data. But anytime you lie to us or you withhold things from us, you could be